is Jennifer and I'll be your nurse for today. I'm just going to come here and put my laptop down, which has all your doctor's orders. And I'm just going to cleanse my hands. And how are you doing? You're doing well? And your IV is infusing okay? No difficulty, no discomfort? Okay, that's what I like to hear. Okay, and can I have your name and your date of birth again? Okay, perfect. I'm just going to check your ID band. Ellen Davis, 9/19/1954. I'm just going to check that against your chart. Okay, and I see that you have any allergies. I see that you have no known drug allergies in our system, but that you are allergic to pollen. Okay. All right. So Mrs. Davis, I told you before that I would be back. So we're going to give you an antibiotic that your doctor ordered, and you're getting this antibiotic because you have pneumonia, which is a lung infection. So this antibiotic, we don't have to put in a new IV line or anything like that. It's going to connect right to your main IV infusion that we just started a little while ago. It's going to infuse for just 30 minutes. You'll get it every 8 hours. So a nurse will come in and will do the same thing again. So you shouldn't have any discomfort. Any questions? Okay. All right, so I brought in the medication, and we have cefazolin sodium, 1 gram, and this will be IV piggyback, and I'm just checking it against your doctor's orders, and it'll infuse over 30 minutes, okay? And Professor, I just want to show you the order so you can see the bottom order. It is cefazolin sodium, 1 gram intravenous piggyback, 50 mLs over 30 minutes, which I calculated. It'll be 42 drops per minute every 8 hours. Oops. Okay. So I checked the order and the medication against each other. That was my first check. I now want to go over my 5 rights. So I have the right patient, I have the right drug, the right dose, the right time, and the right route. So all of that has been verified. Okay, I'm going to put some gloves on. And I just want to take a little peek at my IV line. And it looks like it's infusing well, and there's no signs and symptoms of infiltration on Mrs. Davis, so we're doing good. Okay, so now I have my cefazolin, 1 gram, and I'm going to do my second check before I pierce it with the IV line. Over here, I have a secondary IV set, and I do have I'll just show you, Professor, my sharps container, and I have my box of gloves and sanitizer. I believe you could see that. I also have alcohol swabs. So I'm going to open this. And on the cefazolin, I'm going to pull off the blue cap, and I'm going to use an alcohol swab. I won't actually open it, but I'm just going to pretend I'm swabbing the end of that. And on this kit, I'm just going to make sure my roller clamp is closed. So I'm just going to close it. I don't know if you can see me doing that, but the clamp on the roller clamp is now closed because I don't want to waste any of the medication. Okay, there is a spike. I'm going to pull the plastic cover off, and I'm going to put it into the cefazolin where I took the blue cap off. Okay, that is good. And I am going to come hang this on my other hook. Now, this is IV piggyback, so the cefazolin should be higher than the primary. So this comes with a hook. I'm going to hook it up here and hang the sodium chloride lower. And I'm going to leave this, it's still capped. I'm going to grab an alcohol swab. And I'm just going to squeeze the drip chamber. I want it to be about halfway full. Okay, and we're doing 42 drops per minute. And at this point, I'm going to use my alcohol swab, and I'm going to swab. There's a blue port that's on the IV line, on the primary IV line. I'm going to swab that, take off the cap, and this is sterile, and I'm going to attach it to the blue IV line. So now the two are connected. So at this point, I'm going to open my roller clamp, but I have to count the drops. I'm going to open it slowly. And there are no air bubbles. And I'm just going to count these drops. Okay. All right, and we are at 42 seconds. So I'm just going to check my line. Everything looks good. Okay, and I'm going to get rid of my garbage. My last check was done right when I hung this up with my third check. So the patient has been checked 3 times. I'm going to throw away my garbage. Okay, and clean my hands. All right, Mrs. Davis, so I will be back in about 30 minutes. Your antibiotic will infuse. How are you feeling right now? You don't feel anything again. Well, that's the best thing I can hear. So I'll be back in a little while. Is there anything I could do for you? Now, and remember, you have your call bell should you need anything. Don't hesitate. All right, I will see you in a little bit. Professor, I would also at this point document in DocuCare that I just administered the antibiotic. So that way that part is documented.